This is KAMC News at 10.
These aren't things that I'm asking for us to fund. These are things that I'm saying we need to look at. How do we solve this?
Important things: basic health services, mental health resources, substance abuse care, and more. And not everyone in Lubbock has access to that help. Hi everybody, I'm Brian Mudd.
And I'm Lauren Motter. At issue for the Lubbock City Council is funding for those health care services. They postponed a vote until their next meeting, and some were not happy with that decision. KAMC Kamryn Mendoza spoke with council members about their thoughts on a proposed plan.
Yeah, Brian and Lauren, the health department presenting this plan, which had already been reviewed and requested by the Board of Health to accept. While it was reiterated multiple times that the health department was not asking for funding, they wanted the council to accept the recommendations and results from a recent assessment so everybody was on the same page, but they were met with a different outcome.
How do we make sure that there's treatment available in the community?
Catherine Wells with the health department presenting a 150-page plan known as a Community Health Improvement Plan, or CHIP, in hopes this would answer the looming question.
We've had many children disenrolled from Medicaid over the last 6 months. How do we get those families re-enrolled? We had 12 babies born with congenital syphilis this last year. How do we make sure that our providers are appropriately screening and treating those women so that these babies aren't dying?
The plan coming from a community health assessment done back in September of 2023, which was presented to the council at Tuesday's meeting.
5 areas that emerged from this assessment include access to health care, mental health, substance use and homelessness, addressing chronic conditions, STIs and teen pregnancy, and then improved coordination of information, services, and resources.
District 3 City Councilman David Glasheen says not only does he feel this isn't necessary in Lubbock,
it appears to be used as a justification for expanding government spending on health care.
But he also says the assessment does not accurately depict what's needed for residents.
We have bad data going into the beginning of the study, and with this, you're going to get a biased outcome.
Glasheen's take met with backlash.
This is part of the day-to-day work, this survey that we have to do anyway, and it's going to have to be addressed. My concern is that there's an underlying effort that might be, some politicizing that I think is really the bigger issue.
But ultimately, decisions on a plan would be postponed for another day.
Motion passes 5-1.
The city's role in it, we need to understand what our role is supposed to be, and we as a council need to agree.
And the city voted to reconvene on the decision at their next meeting on January 14th. So they have more time to look at what the plan entails exactly and any changes that they'd like to see.